It's Dr. Shaan here from Rejuveo Aesthetics, and in today's video I'll be talking about all things to do with side profile. So as you know, we're currently in the coronavirus period and we're not holding any face-to-face consultations, so I thought it'd be quite interesting if I showed you guys some tips that you can use at home to assess your side profile, and it's all based on scientific evidence as well. So something I'll be talking about today is called Rickets Line, and Rickets Line is essentially a line which goes from the tip of your nose to the tip of your chin. And what you'd expect in that scenario is that your lips should be around about ½ centimetre behind that line. And a good way that you can check this at home, if you take your index finger, turn to the side, you place the base of the finger on your chin and the tip of your finger on your nose like this. And you can have a go at home as well. And what you'd expect is your lips should be around about ½ centimetre or just about touching that line. Now, of course, that line angle will change. So for example, if your chin is quite far set back, the angle will be like this. Or if your chin is out quite forward, it'd be more vertical like this as well. And that's something I'll be talking about next. So that's cool. That's all to do with the classifications of the jaw. So I'm sure the dentists out there will know this already, but a class 2 jaw is when the jaw is set quite far back, it's quite a weak jaw. And some of the dentists out there, what they can do is they can bring that forward by using a brace on the face as well. But as an aesthetics doctor, we can correct that quite quickly, by using a small amount of chin filler. It takes about 10 minutes, so you can get a really good aesthetics appearance. It's important to remember we're not actually changing the position of the jaw at all. The other way to think about it, if you've got a class 3 jaw, which is where the chin is very prominent and it's quite forward. In that scenario, we can use a small amount of lip filler, not to increase the volume of the lips as much, but just to project them, and it helps balance your side profile with your nose and your chin. And the third thing to remember, of course, with any side profile is to think about the nose. So if you've got a very droopy nose and the tip of the nose hangs low, what you can always think about is something called a tip lift using dermal fillers on the nose. And what you do is you place a small amount of filler just on the tip of the nose just to lift it and raise it. It's really quick, it takes a few minutes, and the results last 12 to 18 months as well. But I just thought I'd share this with you, some quick ways that we can correct somebody's side profile and help balance their features a lot more.